today the daycare called and said he had had a fever, and it was probably like at lunchtime. And before I even left work to go pick him up, I called and they said they could fit him in right at 1:30. So they fit us in really quickly. So I really like that.
I'm April White, and I am the Chief Compliance Officer for White's Pediatrics.
My name is Violet Guzman, and I'm the Business Operating Assistant Front Office Supervisor.
I'm Clara White, and I'm the CFO of White's Pediatrics, and I'm also over the information technology data.
My name is Erin Hundley, and I'm the Administrative Nursing Assistant.
My name is Catalina Morales. I'm Assistant Nurse Manager here at White's Pediatrics.
My name is Jennifer Sharon, and I'm the Business Office Manager at White's Pediatrics.
My name is Christy Jackson. I'm the Nurse Manager here.
Dr. Jeffrey White. I'm a board-certified pediatrician here at White's Pediatrics. Basically, from the conception, from my background as a physician and in training, when I was in residency, I always wanted to have a place that took care of all the needs of a pediatric patient, and that was my goal. And when we opened our practice in 1981, we were pretty much centered on the patient. I had grown up with the experience from a Christian home of the most important relationships that we can establish with people are with people. And when I went into medicine, I went in for those reasons. And so when I went to the school that I was trained at Loma Linda University, we actually had a pilot program called Holistic Medicine back then, and we were learning how to do interviews on patients, including a spiritual interview, looking at their entire life rather than just segments of their life. And I was part of that pilot research program when I went through my training. So that set me up to open an office with the idea that the patient is at the center of the office. And that's the way we practice medicine from the day I started. I need to add one other caveat, and that is the field of pediatrics also coined that term in 1967 of the patient-centered medical home. It was part of the pediatrics purview to make sure that we did not lose kids that had significant chronic disabilities and disorders, that we need to coordinate their care and make sure they received everything that they could. So pediatric field was also a field that was more patient-centered. So when this technical term came out in, I guess, 2006, 2007 from NCQA of the patient-centered medical home, it was a familiar term to us in pediatrics, and for me in particular because of my training. So it was neat to see that take a national attention.
We started on the patient-centered medical home journey in June of 2011. My role was more to be a facilitator, and while things were being implemented, to document what was going on, to make sure we had on paper everything that we were doing, so that when we submitted, we had all the documentation to back it up. And that took quite a bit of time. Some of the other things that I would do on a daily or weekly basis kind of had to be put on the back burner so that we could get the patient-centered medical home stuff rolling.
The main change, we've always done a lot of things geared to patient-centered medical home. The most thing is building our system and documenting and making sure that we keep track and we measure the things that we are doing.
The most important thing is preventative care. So we just really teach them. We just do a lot of educating. It hasn't really changed, maybe just more documentation, but it's always really been that way.
We do a lot more for the patients than we did before. We've always gave great quality of care, but now we, as a whole person, as the family.
It kind of opens your eyes when before it was more about the symptomology of the patient or what was wrong with the patient when they came in. And I've noticed that I'm looking at everything on these people, because the stuff that you have to learn and do and report on is not just about them being sick or whatever. It's if they have socks on their feet. You know, are they taking a taxi here? Do they have groceries at home? Their faith, everything. So when I'm doing my triage, I'm like soaking in all these things that I think it makes me treat the patient better, you know, their needs. So that has changed.
I would say the largest change that we have is many of the things we were doing already to take care of our patient population, but we weren't measuring it. We were just instinctively called on our patients that needed health checks. we instinctively called on our patients that had a chronic disease like ADHD, but we didn't know what percent of our population that had ADHD or asthma or any other chronic disease. So now we know. We know the exact figures of all of our populations. We know the exact numbers of all of the needs that we have, and we are continuing our quality improvement through tracking it through the DataWise.
We've built our trees around our chronic conditions, our asthmas, our weight management, ADHD. So we're doing that to make it easier for them, but at the same time we're getting all this information and doing it in a timely manner.
Which definitely, there's a lot more into the triage than before.
Mm-hmm.
It's not your basic,
No.
what's wrong with you, get on the scale. It's, I mean,
Very
there's a lot of
in-depth.
questionnaires. There's a lot of stuff that I had to fill out and make sure that's done, you know, before the patient leaves. So workflow, I don't think it's hindered it any. We are pretty still on target with our wait times, which we monitor as well. We have to keep, you know, tabs on that. So we've maintained that, you know, standard.
Changes or following up with a patient, more rapid response, communicating more with the patient, listening to the patient instead of us always telling them what to do. We actually listen to them and their problems.
The patient-centered medical home change has been awesome for us. We're working together as a team. We all have certain roles that we play to make it work. We are all focused on our patients. We're focused on seeing them as people and not just as patients with this condition or that condition or this problem or that problem. We're focusing on, look at them as a person. What needs do they have that we can meet?
This is where it gets all done. We're pretty much the first people that the patients get a hold of. This is as well for the front office, but we take all the phone calls here. This is where it all happens. I mean, scheduling appointments, confirming the appointments, getting a hold of nurses, providers. This is our board. We keep our goals and accomplishments here. Since the phone center does most of the work as far as confirmations and scheduling appointments, we like to let them know what they've accomplished. We have weekly and actually daily, weekly, and monthly goals. We give them numbers in the morning. They need to schedule, for example, 5 appointments for the morning and 10 for the PM for a particular provider. Then they come up here and they write their numbers, whatever they've scheduled for that specific provider for that location.
And in our view to make that submission to NCQA for the patient-centered medical home, we looked at what they ask. And what's interesting is that March 2011 is when they made the first inclusion for pediatricians. And we looked at this process in June. So it was brought to our attention by a wonderful organization who said, you guys almost meet this criteria. You might want to look into this. So we did. And as we read through the standards and guidelines that are given to us, we learned some wonderful things. First of all, we did most of what they asked us for, but what they were keying us into is, do you accurately detail this information in a way that you can actually query it and report it? And therefore you can begin a process of not only anecdotally looking at what you do, but now actually measuring what you do. And it showed us that measurements allow you to set goals and reach those goals and set standards and reach for those standards. So perhaps the piece that we didn't have of all these years was that measuring piece. And they brought to us the perspective of not only how to do it, but how to utilize what you're doing.
What has kind of changed is that the data that we've collected, we've been able to look at things, what we did in the past, and we have something to measure it on now. Mm-hmm. Where in the past, we had little things that we would put together, but now that we have gotten involved with the measurements, since we've had the HEDIS, we've been measuring that. Mm-hmm. But now we've entered it to our nurses and to our providers and to our patient satisfaction surveys, which we're getting input from our patients to see what their needs are, what they would like to have. We get more input from our staff. We've always gotten it, but now we're involved in them, so they're excited about providing the services and making us the best practice in the area. So it's kind of helped our morale, and it's helped us as teamwork, as management staff, to be able to work together as a team to accomplish the goals that White's Pediatrics has set out for us.
The main change, we've always done a lot of things geared to patients in a medical home. The most thing is building our system and documenting and making sure that we keep track and we measure the things that we are doing.
The reporting, I think it's gratifying to see the improvements that we've made. You'll see the nurses, we'll let them know, hey, y'all have improved this much on your chlamydia testing or whatever it is, has increased, or your blood pressures or whatever. And they're high-fiving each other and they're like, yay, it gives them something to work forward, work on when you're actually showing them a paper report and real numbers, real legit measurements saying, this is what you did last quarter, this is what you're doing this quarter, and look at your improvement. Good job.
It made me feel really comfortable because like the doctor will order something and everything like that, I need this, and they're like on it right away. And it made me feel like, wow, I'm being treated the right way I wanted to be treated, I was kind of scared and crying, and all this stuff, but they were on whatever they had to do. Like they literally sent me to the hospital right away to get some blood drawn off me, and sent it back quickly to Caroline to see what's going on, and that's when they caught them on know that I had.
They usually call once the night before, and we also get a text alert.
They give really good information, like what's up to date and everything, or any events that are going to be happening, or something that helped out the family, health plans or health fairs that you can go to. They're always up to date on everything. And you can, if you need something for school, you can tell, well, let me check the portal and everything. You have the medical records right there. That's a great place to come. Like they give you a great service and they keep you up to date for everything. I mean, the doctors are great, If you're looking for a certain doctor, you can ask and they request you without doctor only and everything. Doctors are there to help you. They're there to hear your problems, where it's going on. If you don't want nobody else to know about it, it's only you and the doctor. It's a great place to be, and bring your kids here since they were small until you're 21 like me.